pharmacist here in the States, in California. Right now we have a lot of winds and fires. Spent 21 years in the hospital field, I know. Long time, and I've been working with patients in the hospital who are just about to, die pretty much. So I got train wrecks. But most problems they had were diabetes or diabetic complications. So I would tell them how to, take their insulins or show them what to eat before they go home. And usually didn't work because they always end up going back to eating carby food, and that was really frustrating for me. But I am an expert because I had to counsel the patients on various insulins, and a lot of times they couldn't afford it, they didn't know how to use it, or they didn't want to use it. So you had to be pretty creative in the hospital field and cater to the patients. So hi guys, thanks for joining in. So I see a bunch of notes in my screen, so if you have questions, just shoot them out and I will answer as we go along. I won't go too much in detail because you guys are probably well aware of your situation and know that maybe at some point your doctor said you need insulin, right? That's not cool, I know, right? Here's the good news. Insulin is not a forever drug. It's not something you take for your entire lifetime. It wasn't intended to be. It was intended to help you give your liver a rest so that you can still eat carbs, eat sugar, and the insulin that we give via syringe will help push in the sugar into your muscle tissues for energy, for ATP production. That's pretty much what it is. In the meantime, you're supposed to exercise. I know you don't want to, but you gotta. Exercise does help. Losing the weight and eating differently are all the pillars of eventually curing diabetes. Now, I know a lot of physicians and pharmacists don't say cure, but I want to say cure because I want you to understand that the diabetes pathology is fixable to an extent. It's not like a life sentence, in other words, okay? But for a lot of people, it seems like it is because you don't want to exercise and you don't want to eat differently. So what can you eat? What do you have to do to help lower the amount of insulin you need? And we'll go over that right now, okay? So one, insulins are fairly expensive here in the States. So if you live in the States, if you do, just holler out if you live in the States. If you do, they're pretty expensive. The newer ones are actually super awesome because they're more refined, so they have better PK or better pharmacokinetics, So for example, Novolog is a new one that once you inject it, boom, it works right away. And that helps you, let's say you eat a hamburger with the bun and you take a bite of it, guess what? You take a shot of Novolog, let's say 5 units, and it brings your sugar down. Instead of going up to 300, it goes down to maybe 180 within, 2 hours. And that's the goal, right? All right, so that's why the newer ones are awesome because you have better control, but they're expensive. The Novolog one vial is $80. If you use the longer acting ones like Levemir or Lantus, they're about $300. So even with insurance, hey Zach, you live in the States, me too. Even with long-acting with insurance, they still cost upwards to $300 and $400. And that is a problem with the state's insurance because we don't have $300, $400 in our pockets to pay for a one vial of Lantus or Levemir, correct? I mean, I don't have the money. So I understand that is a problem. So even patients have come to me back in the hospital and I said, well, what are you doing back here? And they're like, oh, I couldn't fill my prescription because I couldn't afford the $400 vial of Lantus. And the medical doctor is like, I wrote you a prescription. Yeah, but a prescription's a prescription. It's a paper. It's not money, So you take the prescription to the pharmacy says it's $400, you're gonna walk away. So what can you do? Here's a little trick.